Hey everybody, Dr. Derek Gatta, one of the co-founders here at RiseWell. Excited to have you today for our engaging discussion with Dr. Toni Engram from the Flourish Dental Boutique. So I'm going to go ahead and invite her to join. So give me a moment while I do that. And we should be good here. I think we got her. Hey, Dr. Toni, how's it going? Hey, wonderful.
Hey,
Well, thank
Dr.
you so
Derek,
much
how
for
are
making time
you?
for us today. We're
Absolutely.
excited to have
Glad
you
to
today, and
join
I want to go
you.
ahead and just read your bio so our viewers kind of get a better sense of who you are and what you've been up to and your path to dentistry here. So Dr. Engram grew up in Hillsborough, Texas, where she met her future husband and graduated second in her high school class. She attended Texas Christian University and graduated magna cum laude with a Bachelor of Science degree in biology. She earned her doctorate degree at Baylor College of Dentistry. After her own personal health struggles with an autoimmune disease, Dr. Engram shifted her practice philosophy to focus on whole body health and the prevention and safer treatments of oral disease. As a general dentist focused on holistic and biological dentistry, Dr. Engram is a member of the Holistic Dental Association, the International Academy of Oral Medicine and Toxicology, and the International Academy of Biologic Dentistry and Medicine. She is a SMART certified in safe amalgam removal technique accredited through the IAOMT and is a TBI ambassador through the Breathe Institute. She is also a certified integrative health coach through the Institute of Integrative Nutrition. Locally, Dr. Engram is a supporting member of the Dallas Holistic Chamber. Wow, that's a mouthful. You got the ABCs of credentials and distinctions there. Hey, no worries. Well,
Thank you. I
go ahead and tell
appreciate it.
everybody kind of your path to dentistry and a little bit more of your background and kind of how you ended up in your Flourish Dental Boutique there in Texas.
Well, I wound up in dentistry really because I love helping people. I love healthcare. I know that sounds super cliche, but I really just enjoy these one-on-one health conversations. So it's all about the relationship with patients. That's what kind of led me to dental school in the first place. Now, when I went to dental school and graduated and started my own practice, I really just wanted to be a normal dentist. So I had no intention of doing anything like weird, holistic. I for sure didn't want to be one of those dentists that my instructors warned
Oh,
us
heaven
about,
forbid.
the ones who did, right, right, who did all the stuff with the amalgam fillings. So it really, I fought against it, but back in 2011, I was working full time as an associate dentist. I had one toddler and I was opening a practice from scratch. So really I was working super hard. I wasn't getting the sleep I needed. I wasn't eating the way that I should have been eating. And I got super sick. And it really took a while to have different doctor's visits and try to figure out what was going on. Um, After about probably 6 months, we finally discovered that I had
Oh no.
Crohn's colitis. And the you know, you say, oh no, and it was really upsetting at the time, but really and truly, the best gift God could have given me, especially for my career, because it really was the catalyst that led me here sitting with you and led me to get to do the really cool things that I get to do now. So when I was diagnosed with Crohn's disease, my physicians told me, they said, here's your list of medications. You're going to be on these forever. And at some point, you're going to need surgery
Oh
to
no.
remove all or part of your colon. It was just kind of the typical Western medicine solution, which I it just really upset me. I didn't feel like that was the right answer for me. So as I started going down all of these rabbit holes to heal myself, because I just didn't accept their answer. I learned about nutrition and about managing stress and about healing my gut. And lo and behold, as I started to learn more and more, I realized that the Crohn's disease that I was struggling with is really just a dysbiosis and an inflammatory condition. Well, goodness gracious, Derek, what do we treat every day? We treat tooth decay and gum disease. It's all about dysbiosis and
Absolutely.
inflammation. So if I figure out how to get myself well, and I did, thank goodness, I was able to figure out the things that worked for me and was able to heal. As I figured these things out, I just thought, man, I'm a hypocrite if I don't figure out how to do the same thing for my patients. And so really that's what kind of led me down the path of oral systemic health and learning how the health of your mouth is connected to the health of the rest of your body. Learning that there are safer products and materials that we can be using for our oral care. And really, my patients kind of helped push me the rest of the way. Like, oh, well, if you're wanting to get into nutrition like this, what are you doing with fluoride? And if you really believe these things, are you protecting yourself when you take out these old mercury fillings? So that's kind of the very windy path that led me to biological dentistry and led me to
Thank you
Flourish Dental
for
Boutique that
sharing
we have
your
today.
background. You brought up so many good points there, and there's a lot to kind of just go into and explore. And again, just looking at traditional dental school education, I mean, nothing against that. The schools are designed to help produce competent dentists who can pass state board exams and treat people in a safe manner. But it is kind of interesting how a lot of the education we've had since dental school hasn't really made it into the classroom yet, and some of these just conservative institutions. So at some point maybe that might be changing in the future here. But also really resonated with some of the topics you spoke on in terms of these definitions of traditional dentist, holistic dentist, biological dentist. Maybe just kind of highlight for our viewers what that means and kind of where you fall in that kind of category.
Yeah, absolutely. That's a great question. And a lot of times the terms are sort of used interchangeably. Holistic dentist I use a lot, biological dentist. I know a lot of people use the term functional dentistry. There's a lot of airway stuff, so airway focused dentistry kind of gets woven into some of that too. But really the thing is that biological dentistry really is very holistic. We take a whole body approach to oral care. When we have a choice, we always want to prioritize prevention and nutrition over treatment. That's not always possible, but that's always our primary goal, is if we can prevent something, that's better than having to go in and treat it
Absolutely.
with more traditional dentistry. And that means I source my materials very intentionally, including using RiseWell products. It goes beyond just avoiding fluoride in the practice or just avoiding those fluoride treatments. We're really, really intentional with making sure that every product that we use is the safest product that we can find, but also the most effective. And that's not the same for every patient. One man's cure is another man's poison. But we're very, very intentional to make sure that we're sourcing things very carefully. And all of that really goes back to the origins of biological medicine and biological dentistry. And the origins of that are really taking germ theory that we've used in dentistry and medicine for over a century now, It's taking germ theory and going a step beyond to the terrain theory of health and disease. So in germ theory, which is absolutely true, we're taught that a specific germ, there is a substance or a thing that causes an illness. Well, terrain theory says, okay, we actually need to look at the whole terrain of the human body and of the environment. And what is the toxic burden, or what is the load on that person's terrain? And this is where it really is different for each individual. So it may not be that a root canal or 5 root canals are harmful for one person, but maybe in another person whose terrain is more compromised, whose toxic burden is more filled to the brim for them, then maybe, perhaps, a root canal isn't the best option for that specific person. Same thing with other materials that we use. Whether that's the filling material, whether it's the toothpaste that we use, it's not just one thing. It's each person's terrain, and so that's kind of the basis, the theory behind how we practice biological
Thank you for that
dentistry.
overview and definition, because I know those terms are kind of loaded and can be confusing for people out there. So that's a good overview and very, very detailed analysis. I really like the analogy and the how you described that. So I'm curious, when you have new patients to your practice, a lot of patients out there, they might not be used to seeing a dentist with your skill set. They may be seeing dentists in more of the conventional manner of a traditional type dentistry. And when they come to your practice, they might be kind of blown away or kind of confused. Why is she asking all these questions, or why is she doing these tests? And how do you kind of guide patients along their journey and let them know that why you're different and why the value you're providing is kind of a different philosophy for other offices in your community there?
Well, I think some of the things will be very familiar to patients. We still take x-rays because x-rays are needed to see certain things. We still clean teeth, do fillings and crowns and all the things. But yeah, you're right. We're absolutely looking at everything in more of a whole body context. And so that does mean we're doing maybe more testing. We're testing salivary pH, or we're doing some detailed saliva testing, where anytime there's somebody with decay, then we're not just they're not chugging soda all the time, then we really need to look at those root cause issues. And so we're discussing all of those things. We're discussing the patient's gut health. We're discussing the transmissibility of the bacteria. Are there any medical things going on that could be influencing decay, whether that's acid reflux or any other number of things? So I think for some patients, yeah, their visits may look very similar to a traditional dental office, aside from just we have really cool tools and cool gadgets and different products. And then for some people, it really will look much more comprehensive because we're really doing our best to get to those root causes of disease where they exist.
No, that's great to hear that, and thank you for sharing. I'm also curious, do you do any services like ozone or any treatments that our viewers might not be familiar with?
Yeah, I use ozone in really every single day, and we use it in several different ways, which are really fun and cool. So we actually use ozone. For those of you who don't know, if anybody's watching who doesn't know, ozone, we're using medical grade ozone. So we take medical oxygen, we run it through an ozone generator. And when you apply that electric charge to the oxygen, it becomes O3 instead of O2. And O3 is a really powerful oxidizing agent that can effectively kill bacteria, fungi, viruses, and can help clear away any of our dead or unhealthy cells that we have as well. And then with our cells that are healthy, it provides this nice boost of oxygen that upregulates the immune response. And so the effect is that depending on the dosage used and how we use it, we can kill all kinds of bacteria in the mouth. We can help support the healing process and do it in a way that really has very little side effects, which is amazing. So we ozonate our water every single morning when we come to the office. And so all of the water that runs through our lines is ozonated, which helps keep it clean for one, but also has a therapeutic benefit. And then we'll use, when we need stronger applications, then we'll use the ozone gas, either directly around the gum tissue. It's called insufflating. We're insufflating those periodontal pockets, or sometimes we'll even inject it into the soft tissue or even into the bone if we have areas that we're really trying to get some more intense healing
It's
action.
really wonderful to hear about that, and I needed an overview myself, but it's wonderful that your patients have access to that treatment, and you're helping so many people there. I'm also curious, I hear you have some different courses and programs for your patients, and I think there's one, I was reading on your website, the 90-day Cavity Cure Accelerator, and can you tell us more about that and some of these different opportunities for learning and treatment you have for your patients there?
I would love to. I'm really, really excited about it. And I
All
even
right.
have an announcement that I
All
haven't
right.
said publicly yet. First. So really in the practice, as many cool gadgets and tools and testing that we have, it really was not enough to move the needle for some people. For some people, especially a family that's struggling with tooth decay specifically, they just needed a better plan. And coming every 6 months or even every 3 months, it just doesn't do it. They needed more information. They needed to know exactly what to do and when to do it. And they needed it to be tailored exactly to them and to their family and their specific mouths. So I created the Cavity Cure 90-day accelerator. And in that program, it's 90 days, and it is exactly that. It's very specific testing, and it is very guided, directed game plans. Here's exactly what you do and when. We tell you how to eat the foods that you need to eat, how to make it work if you've got little kids, how to make it work if you've got elderly people in the house. And we know that anytime a patient follows these steps, when we completely transform the microbiome, when we completely transform the buffering capacity of the saliva, then we absolutely can make a difference and have these patients be healthier at the end of 90 days. So I believe in it so much that I decided to guarantee it. So anybody who completes the program, if they don't see results in their salivary diagnostics and their saliva tests, then I will personally meet with them every single month for strategy calls until we do, because I know that it'll work. I know it works. And then the fun announcement is, now that the program launched and has gotten off the ground, and people kept asking from our Instagram community and people out of state that just can't make it in. You know, we've got a lot of patients that travel to come see us, but for those of us who just couldn't, we are now officially making the program available completely virtually, so that anyone out of state will be able to complete the 90-day accelerator also. We'll help you work with your dentist locally. We'll help you find a biological dentist if you don't already have one. And we'll get everything done without you
Wonderful.
having to travel
Congratulations.
to come see us.
Yeah, it's a big... No,
Thanks.
that's wonderful.
Excited about
And you make a lot of good points. And just like how Weston Price spoke about nutrition back in the 1930s with some of his work, a lot of it just goes back to what you're eating. And a lot of times patients don't realize that. They think it's just brushing and flossing techniques, and those are absolutely helpful. But, you know, it's really hard. We can't combat fermentable carbohydrates and sugars that they're consuming on a daily basis. So I also talk to my patients routinely about nutrition, what they're eating besides traditional foods, what are they drinking besides water, any energy drinks or sugary sodas that are absolutely counterintuitive and just challenging to the oral environment and create that demineralization process. And also a lot of times people don't realize that things like crackers and pastas, they're also, at the end of the day, they all reduce to sugars. If it's not reducing to fat or protein, it reduces to sugars, and patients need to be aware of the kind of the fermentable carbohydrates they're taking in and how that might be leading to the carcinogenicity of their mouth and those cavity forming factors once your pH drops below 5.5. So yeah, all good, and glad to hear the success of that program. And a lot of it just goes back to educating patients because it's such a preventable disease.
It really is. It really is. And if we can just do the things in a short amount of time, if we can just flip that switch, then what's really cool is when you get to see a young family that does it. And you know for a fact, because we know that bacteria that causes cavities is transmissible. So you know, if you can make a difference for a mom who then makes a difference for her kids, that you literally have transformed that family tree. That's what makes, I think, our job so rewarding and so exciting. Is you really can't. You can change an entire family.
You really can't. That's a great point there, and it's very rewarding when you see that cycle of cavities being broken from different generations. It's really helpful. I don't treat kids in my practice, so I don't see it as much, but you know, I imagine it is rewarding for people that do treat kids. So that is really good.
Yeah, but
that's true.
Mom, then you are treating
that's a great point.
Kids. 100%.
No,
You're treating those kids too.
That's a great point. Also, any advice or recommendations for new mothers, expecting mothers, women who are pregnant, and how that may affect changes in their oral condition, oral hygiene, and just factors around new mothering and pregnancy?
Absolutely. Man, if I could, and I tried for a long time, I tried to meet with different OB-GYNs, you know, OBs who are like the delivering baby kind of OBs. I tried to get in and just encourage them to send their patients, to send these moms to a dentist, even if it wasn't me, any dentist, to make sure that they're getting the dental care they need during pregnancy. And I just, maybe it's different for you in your area, but it just felt like banging my head against the wall because these OBs are already so busy and so overwhelmed that it's just one more thing that they just don't have time for. So if I could yell through a virtual megaphone to the entire world and say, pregnant moms, girls who are thinking of becoming pregnant, women who are thinking of becoming pregnant, if you can get your oral health good before that pregnancy or during that pregnancy, outcomes will be so much drastically better. You know, even some of the earlier xylitol studies, just looking at pregnant women who were chewing xylitol gum, their kids had fewer cavities at 5 years old than the ones who didn't.
Yeah.
Huge. Just such a simple little thing, like chew some xylitol gum. Goodness gracious, use some RiseWell. Start brushing with RiseWell during pregnancy. And how much impact that would have if you knew that you could do something that would give you a leg up before they're even
it's all
born.
good advice. It's wonderful to hear that, and you know, I hope our audience can help spread that message as well, and just get your mouth healthy before you start having your family. It just really adds to your health, and also just looking at some of the changes that happen too. A lot of times new mothers might not anticipate, you know, things like pregnancy gingivitis, or, you know, your teeth feeling a little bit more mobile during pregnancy, which happens sometimes in women. And so there are some, with all the hormonal changes that are happening, your mouth will feel and operate a little differently during pregnancy, and all the more reason to get reassurance from your dentist during that time period and make sure you're your mouth is up to par with its health.
Absolutely.
So also, when you're talking about
Absolutely.
materials, when you talk to people in your office about things like hydroxyapatite and different alternatives to fluoride, how do they respond, and what kind of conversations do you have around those materials?
I would say, because when I opened this particular practice in 2020, um, I have only been a biological dentist in this office, in this practice. So I think because of who I tend to attract, I really don't get any pushback at all on the no fluoride issue. Most patients are really excited that they have other options available. And most patients are really excited that there are materials out there now, that there are products out there that can be as effective, if not more effective than fluoride at reducing their risk of cavities. It's huge. It's huge, especially for patients who really care about safety and the health of their family. And just the value statement of, I want to only use products that I know are safe and have few, if any, side effects. Then that's where using products with xylitol, with hydroxyapatite, are
No,
just
that's
an
great to
all
hear,
win.
and I'm glad it's resonating well with your patient base. And it's funny looking back at dental school for myself. I think maybe one lecture during oral histology class, the word hydroxyapatite was used in passing, referencing the structure of enamel. But besides that, man, I had no idea until, my sister and brother-in-law, we started this company and started looking at alternative materials that were used in other countries, that was an option as a remineralizer, and it's kind of a game changer, and really kind of feel like the wool was pulled over my eyes in a sense, and that some of these options just aren't really spoken about in traditional dental educations and curriculums, and that might be changing in the future. But I was just pleasantly surprised with the research backing hydroxyapatite as a remineralizer, and also the wonderful added benefit of sensitivity relief that helps a lot of people. I'm just really glad it's helping your patient population as well. So thank you for the support.
Absolutely. Absolutely. No, we're so thankful for you guys, and have been such big fans since we launched this practice. And RiseWell's just been such a good partner for us that we're excited. We're excited every time you come out with a new flavor, with a new formula, with a new
Hey, thank
product.
you.
So keep them coming.
Any other topics you want to talk about today, or questions for me, or anything on your mind?
Oh man, you know, I I love all of your products so much. I will say, and my patients are super savvy, and they are very detailed ingredient watchers. So I would love to hear from you. I know what I tell them, and I know what I tell them based on the research. So I would love to hear from you specifically. So I know xylitol's amazing. That is a great cavity reducer. Hydroxyapatite, amazing. That's what we need to remineralize. Tell me about the purpose of glycerin and why it's included in
So
RiseWell.
you have great questions here, and when we try and be as minimally invasive and low molecule, low chemical, low detergents as possible. So glycerin is used to create a wet mouth feel, and a lot of times too, these agents help hold everything together. And in addition to having something that is remineralizable, we want to make sure that we're providing a great experience for people too, and not just a little snot coming out of the tube. We want to have consistency, some body, and an overall nice experience. And glycerin is something that helps us with that. It's non-GMO, corn derived. Everything is certified clean by the Environmental Working Group. And it's water-based, so it's not going to inhibit or impair your ability to remineralize or block any of those processes. So those are some of the to try and be bare bones about what our product is possible, there's some things that are just hard to get away from and still provide a nice experience for people.
No, I think that's absolutely right. And I know the concern, or at least some of the concern that sort of spins around among my patients is, will glycerin make it too slippery so that the hydroxyapatite doesn't absorb into the enamel? And I have not found any evidence of that in any of the literature. And so
Yeah,
I'm
we
assuming
haven't
you
seen
haven't
those
either.
reports, and I know there's some stuff circulating online about that, but it's water-based, and it should not be inhibiting any of the remineralizing effects of the hydroxyapatite from what we've seen.
Completely agree. Completely agree. No,
Well, thank you. And I want to open
it.
up any questions to our viewers out there. If anyone has anything on their mind, I'll kind of scroll back to the comments, and Toni, you as well. If there's any questions that you had seen, we're happy to help out everybody.
Oh, Doctor, thank you.
Well, again, guys, last chance for questions. But again, Dr. Toni, thank you so much for taking your time today and sharing your wisdom and knowledge. And again, we're just excited to have you in the community and proud of everything that you have going on in your world to help your patients there in the Dallas area. And any exciting plans or anything coming up in your near future, or anything you want to announce or publicize, or where can people find you and support you?
Oh, awesome. So, and this ties into, someone had a question too about where to find a biological dentistry near Corpus Christi. So I will say that I don't know anyone specifically in Corpus, but the organizations that I'm a part of, the IAOMT and the IABDM, are probably the biggest organizations that help train biological dentists. And both of those groups have really active, good directories. So I would check out the directories for one of those. Exciting stuff happening in my world is launching the virtual version of the Cavity Cure 90-day accelerator. I think it's going to keep me busy for the rest of the year. So I'm super excited about that. You can find us here on Instagram at Flourish Dental Boutique, or online. Our website is www.flourish.dental. And we have a newish podcast that is anywhere podcasts are, and it's just the Flourish podcast with Dr. Toni Engram. So I hope to see you in one of those places, or all of those
thank
places.
you so much for everything today, and everybody go support Dr. Toni Engram, and just thank you for all that you do, and have a good one. Thank you.
Likewise.
All right. Bye-bye,
Dr.
everybody.
Derek, I appreciate you.